Okay, Miss Grant, so before we get started today on treatment, I just need you to sign this consent form for me. Perfect.
Thank you.
And then if you'll just have a seat in the waiting room and we'll call you as soon as we're done with treatment.
Okay, have fun. I'll be right outside, okay?
Okay. Alrighty. Dr. Key? Let me just wash my hands real quick. Okay. I'm going to go ahead and lean you back. Okay. Just takes a little bit here. There we go.
Oh my god, all day.
You're a little anxious. You're excited. More nervous.
Nervous.
Who do we have here? So this is Lauren. She's going to be getting some fillings done today.
Hi, Lauren. Nice to meet you. I'm Dr. Key. Have you ever had a filling before? What's that?
No?
Don't worry. It'll be super easy. You won't even notice. So do you have any plans for Halloween?
I'm just gonna be a princess for Halloween.
All right. I can give you some princess teeth today if you want.
Nice.
All right. Let's go ahead and get strapped in. Okay. I'll start putting these bracelets. There you go. I have this bracelet. I'm gonna put this around your wrist. Princess bracelet. Turn your arm this
Gotta
way.
stay still. I need to put
Don't
these
wiggle
on
your
you.
feet, please. Go ahead and put that one. I'll put this one over her head.
Okay.
This is a princess strap. Go ahead and lean forward.
Wait,
It's okay.
why are you putting these on me?
We're gonna put you in a little burrito.
Okay, the tighter the better. We need it to be tight.
I don't
Let's
like
make it really
it.
tight down here first. Keep your
Stop
legs still.
moving.
Don't
You
move.
can't be moving.
I don't like
Stay
this.
still.
Keep still. We have to.
No,
Don't move. Stay still. Now
No.
we're not going to be able to do your downward.
I don't like this.
Don't move. Keep your legs
No.
still.
Where's my mom? I don't like this.
This is bubble gum.
No,
Lay back.
I want my mom.
What's going on?
We have her in the Papoose. We're about to get started. Can you have a seat in the waiting area, please?
I can hear her from the waiting room. I'm not okay with this. What is this? I didn't agree to
You
this.
signed the paper. We're gonna get started. We're already
Nobody,
ready to go.
Nobody explained it to me. I don't want this. We're done. She's not even comfortable. We're done. No, we're done.
Okay, Miss Grant. So, my name's Alexis. I'll be Lauren's hygienist today, in addition to Dr. Keith. She'll be doing her extractions. I just wanted to show you this consent form. We're going to be doing a couple of extractions, a couple of fillings. We're going to be using a Papoose board, and that just helps to restrain her so that way she's not grabbing while we're trying to do any injections and hurt herself.
She's still able to breathe though? Like it's not.
Yes, she can
Okay.
still breathe like normal. We're also going to be putting her on nitrous and oxygen.
Okay.
So she'll be perfectly fine. It helps her to relax, kind of makes her feel a little loopy, and just so that she's just super comfortable for
Okay.
treatment. So if you'll look that over, and then I'll have you sign the consent form whenever you're ready. You ready for your treatment today?
I'm just a little nervous.
Yeah, that's what the laughing gas would do. It'll probably make you feel a little funny, like you're on clouds. Just have a good time.
There you go.
Thank you. And then, do you have any questions?
Yeah, I just have
concerns?
a couple questions for the doctor.
Okay, perfect. Yeah. I'll call her in, and then as soon as she comes in, feel free to ask her any
Okay.
questions you might have. Okay.
Okay.
Perfect. Keys. Then we're ready for treatment.
It'll be good.
Hi, how are y'all doing?
Good.
Nice to meet you.
Nice
I'm
to meet
Dr.
you.
Key. So you're Lauren's mother?
Yes.
Okay, did you have any questions for me today?
Yeah, she had mentioned a couple extractions that need to be done. I just want to verify what was going to be done.
So
And how much is getting done today?
She needs 4 extractions.
Okay.
2 are on the upper right, 2 are on the upper left. She also needs some fillings and a cleaning.
Okay.
So I would like to do 1 quadrant today, just the upper right, and then we'll reschedule her to come back for the other side.
Okay. Will she get the extractions and the cleaning done today then?
Yes.
Okay.
We'll try to do half of it, and then the rest if she comes back. And we'll be using the Papoose board, so that's just gonna hold her in, keep her still. It's gonna wrap her around, and we're also gonna put some laughing gas on her. So
Okay.
it's not gonna sedate her. It's not gonna put her to sleep, but it's just gonna relax her. She'll be awake and calm. And we also have to give her. We'll we'll say sleepy juice, so she's not aware of what it's called,
Okay.
and she won't feel anything. Okay.
Okay.
Did you have any other questions before we
Can
get
I
started?
stay in the room or do I have to go? I
No,
stay
you
in
can
the
stay in the
room?
room,
Okay,
of
perfect.
course.
Okay, thank you.
No problem. Let's go ahead and get started. So we're gonna get her in that.
So we're just gonna start to put her in the papoose board.
Okay.
Okay, sweetie, you can just step out of the chair for me. Just gonna place this underneath. I'm just gonna have a seat on top of it. Alrighty, you'll have a seat right there. You can have a seat right there,
Okay,
Mom.
I just wanted to get out of your way.
No, you're fine.
Okay.
You're totally fine.
Okay. Just gonna put this little bracelet over here to the side. So I'm just gonna put this over your wrist. So this is kind of like a little restraint on your arm.
Shouldn't hurt. So you're gonna go over your feet.
And then this one goes over her arms.
Okay.
Just let me know if it's too tight. I can loosen it up. Lean forward a little bit. Is that okay? All right. I'm gonna go ahead and place this one up here.
I'm gonna go ahead and start leaning her back. Actually, gonna move over here. Excuse me.
Yes. So you're gonna dress up for Halloween this year? All right. What you gonna be?
I'm gonna be a princess.
Princess? What's your favorite princess?
Bella
Bella.
from Beauty and the Beast.
Nice. Okay, so let's go ahead and put this, this layer on top of this. So we're wrapping you with this. It's like a little blanket. Make you look like a little burrito. Does everything feel okay?
Or is this gonna be long?
No, it's not going to be long. It's going to be about 30 minutes.
You'll be okay, sweetie. Mom's right here.
Yeah, your mom will be in the room the whole time, so she'll be right by you.
So we're going to put this bubble gum mask on you. And when we put this on, we want her to breathe in and out through her nose. Don't breathe in and out through your mouth. That way it can work best. So go ahead and lean forward. Does this feel okay? You want me to adjust it?
Alright, breathe through your nose like they said.
So we're gonna have her breathe this for about 5 minutes, and then we'll go ahead and give her that sleepy juice.
Okay.
Okay, so as a dental assistant, I did use the Papoose board, and during my experience with using the Papoose board, I did see a lot of children screaming and crying, and they were mostly afraid because they were tied up and they weren't really familiar with what's going on. There's a lot of noises, and so as a dental assistant, it can be pretty scary because you have to be quick and make sure that the child isn't moving too much. And so often we would have a head holder, which would be somebody who held the head in one position, holding a mouth prop to keep their mouth open, and then we had an assistant who would have to be really quick and make sure the whole setup's there. And the dentist had to make sure that they were safe with using a handpiece, giving the shot, because even though they're strapped in, they can still move and break out of the papoose. So it's always good to make sure that you also tell the child what you're doing, talk to them about tell, show, do, and then don't use real terms, like don't say you're gonna give them a shot, tell them I'm gonna give you sleepy juice. And if they have a cavity, tell them you have a sugar bug, so we're gonna clean that out. Because once you say the word shot, they're gonna get really scared and they're not gonna wanna do the procedure and cooperate. So it's important to make sure that you have the cooperation of the child and the parent. Make sure that you have the consent form before you get started and everybody's on the same page. You wanna make sure that the parent is comfortable with you as a provider, and let them know they have other options, so they can go see a pediatric dentist, because a general dentist may or may not be able to give them the cocktail juice for them to sedate them. They may not be able to take them to a hospital to have them sedated to do the work. So Papoose nitrous may be the only option. So let the parent know that they have autonomy, so they can be able to go to different areas wherever they feel comfortable.
I believe that the Papoose board is a perfectly fine option if the parent has a full understanding of its use and it will benefit their child most for the dental procedure to be done. I believe that the parents should be allowed to stay in the room with their child while the Papoose board is being used, and this will allow for the child to feel safer and the parent to feel more comfortable with the procedure and the use of the Papoose board. Misuse of the Papoose board is common and can happen, and as a parent it is best to be well informed with the dental clinic that you're at if the Papoose board is to be used and the benefits of it, and to also know the procedures that are going to be done that make it beneficial for their child.
Okay, Miss Grant, if I could just have you sign this. You eat candy all the time?
Yes.
I'm gonna go ahead and put your backpack to the side.
Alright, what are we doing today? So do you have any plans?
No.
Sorry, I was supposed to introduce myself.
You're fine.